I'll be your nurse today. We will be doing a musculoskeletal assessment. Do I have consent to videotape?
Yes.
I've washed my hands. I'm going to start with inspection. I'm going to inspect the wrists and the fingers. I'm going to look for asymmetry. I'm going to look for redness, swelling, any nodules on the fingers, any gross deformities. I'm going to palpate the radial head and the ulna head. I'm going to palpate the carpals, the metacarpals, the PIP joints, the DIP joints for any swelling or tenderness. I'm going to have you flex your fingers up, flex them or extend them down, and abduct them and adduct them. And then we're going to do your wrist. Go ahead and make a fist. Flex your wrist up, extend down, adduct, and abduct. Okay, now I'm going to have you turn your wrist over. I'm going to assess for carpal tunnel syndrome. I'm going to do the tunnels test. I'm going to pull the hand down and I'm going to tap on the median nerve here. And then we're going to do the Fallon's test or the prayers test. So go like this and we're going to hold it for 30 seconds. Okay, we'll say that was 30 seconds. Any numbness or tingling after the fact indicates that there may be a carpal tunnel syndrome going on. Now I'm going to look at the elbows. I'm going to look at them bilaterally. I'm going to assess for redness, swelling, any asymmetries, any gross deformities. I'm going to palpate the lateral epicondyle and the medial epicondyle and the olecranon process. Again, I'm going to assess for the lateral epicondyle and the medial epicondyle and the olecranon process. The lateral epicondyle, if there was tenderness, that would be associated with golfer's elbow. The median would be associated with tennis elbow. Now I'm going to do flexion extension. I'm going to do this for you, passive range of motion. Flexion, extension. Flexion, extension. Okay, now I'm going to have you do flexion, extension, and then we're going to pronate, facing down, and then supinate. Pronate and supinate. Okay, now we're going to move on to the shoulders. I would inspect for redness, swelling, any signs of infection, any gross deformities. I would palpate for the lesser tubercle and the greater tubercle. And then we're going to flex. Okay, go ahead and stand up. Flex your arm out. Let me do this. Extend. Flex. Extend. Okay. And flex your arms all the way up. And extend them all the way back. Okay, and then you're going to abduct away from your body and then adduct. Okay. Okay, go ahead and sit down. Now we're going to do the scratch test. So I'm going to have you put one arm up to your neck and then put it at the opposite scapula. Okay, now the other arm, back of the neck, and then back around to under the scapula. This indicates a possible rotator cuff injury. Now we're going to do the drop arm test. Stand up. Stand right there, face this way. I'm going to raise the arm. We're going to abduct the arm all the way up and hold it there. Okay. If it were to fall, that would indicate a possible rotator cuff injury. Abduct. Okay. Okay, now we're going to do the head and the neck. Go ahead and sit down. Okay, I'm going to look for asymmetry, side to side, redness, swelling, any signs of infection. Obviously the shirt would be off. I would palpate for the sternocleidomastoid muscle, the trapezius muscle, the sternoclavicular notch. I'm going to palpate the temporal mandibular joint. I'm going to have you open your mouth, assess for any popping or clicking or pain or tenderness, and then open your mouth wide. Okay, close. Now move your jaw side to side. Okay, that would indicate some TMJ issues. I'm going to assess the neck, looking for the trachea to be midline. I already palpated the muscles, inspected for redness, any deformities and signs of infection. Now I'm going to have you flex your head down, extend your head back, rotate side to side, and then we're going to do lateral bending each way. Okay. And now I'm going to do this Sperling's test. So I'm going to have you turn your head to the side, lean back just a bit, and then I'm going to push down on the head. This you would not do in the elderly population. The other way, back just a bit. If there was pain here, this would indicate radicular symptoms. Okay, go ahead and stand up. And go ahead and take your shirt off. And then stand right here. Okay, face the other way. Okay, now I'm looking at the spine. I'm looking at posture. I'm looking for any redness, tenderness, asymmetry, any gross deformities. I'm looking for any scoliosis. I'm going to palpate the vertebra, palpate the cervical here, down to the thoracic. Looking for any pain or tenderness, any step-offs, lumbar, and then all the way down to the sacral, a little bit further down. And then I'm going to palpate the muscle on each side of the vertebra for any pain or tenderness. Okay, now I'm going to have you extend over. Again, looking at posture, looking for any rotation of the shoulder, any rotation of the spine that would indicate scoliosis. Okay, stand up. Now bend back just a little bit. This is extension, looking for range of motion. Okay, stand up. Now we're going to twist, rotate side to side. Okay, and then lateral bending to the side. Okay. Let's go ahead and have you lay down. Move to the hips, lay all the way back. Okay, we're gonna start by, we'd inspect the hips for any asymmetries, any redness, swelling, any gross deformities, any rotation. We'd palpate the hips if there was any complaints of hip pain or tenderness. Then we're going to do passive range of motion. So we're going to flex the leg up. Okay, roll on your side. That way. And then we're going to extend the leg back. Okay, go ahead and lay back. I'm going to have you flex and extend both legs. Flex your other one. Okay, roll on one side and extend back. Okay, and then go ahead and abduct while you're in that position. Nope, nope, nope. Abduct to the ceiling. Okay, roll on your back. And then you're going to abduct across your body. Okay, now roll this way. Okay, extend your leg back. Okay, and then abduct away from your body. Now lay on your back and abduct across your body. Okay. Now we are going to do the straight leg test. So raise your leg up and hold it. Any pain associated with raising the leg 45-degree angle or lower would indicate a sciatica related to a herniated disc. Do the straight leg test on this side. Okay. Now we're going to do the Thomas test. This is going to tell me if there is any hip contracture issues. So pull your knee up and pull it all the way to your chest. Okay, and do the other leg. Okay, perfect. Okay, now we're going to check for external rotation of the hip. So we're going to do the Faber test. So with this ankle, I want you to put it right here. Okay, and then I'm going to push down on the knee. Okay, now that ankle right here. Yep, push down on that knee. Okay, now I'm also going to check for external rotation of the hip. Go ahead and cross. Okay, put that leg down, this one up, cross, just the knee. Just going to push on the knee here. Okay. Okay, now we are going to look at the knees, checking for asymmetry, any fluid, swelling, redness, any indicators of infection. Then I'm going to palpate the medial condyles, the lateral condyles, the tibial condyle, and the fibula condyle, and then the patella. Come over here. Okay, now I'm going to put my fingers back in the fossa here, feeling for a Baker's cyst. No Baker's cyst. Okay, now we are going to do the anterior drawer test. I'm going to sit at the edge of the foot. I'm going to pull on the tib fib, pull on it forward to see if I can slide it out. That would indicate an ACL tear or issue. Then I'm going to do the posterior drawer test where we push back. That would indicate ACL issue. Do the same on the other side. Anteriors, we're going to pull out. Posteriors, we're going to push back. Now I'm going to do the Lachman's test, where we're going to apply pressure to the tib fib and the femur, and that would indicate an ACL issue. Again, the Lachman's test. Okay, now I'm also going to palpate the meniscal grooves, medial and lateral. That would indicate a meniscal issue if there was any pain or tenderness there. Now I'm going to do the varus and valgus test. I'm going to push on the medial side of the ankle, and that is the varus test. And then on the lateral side, which is the valgus test, that would indicate a meniscus issue. Same with the left side, pushing on the medial side of the ankle. would be the valgus test, and the varus would be pushing on the lateral side of the ankle. Okay, now we're gonna move to the ankles and the feet. I'm going to inspect the ankles and the feet, looking for any gross deformities, any redness, swelling, any trauma, any signs of infection. I'm going to palpate the lateral malleolus, the medial malleolus, the calcaneus on the right foot, and I'm going to palpate for any plantar fasciitis. I'm also going to assess for a flat foot. I'm going to do the same on the left. I'm going to palpate the lateral malleolus, the medial malleolus, the calcaneus, and I'm going to palpate for any plantar fasciitis, again inspecting for a flat foot. I'm also going to palpate the tarsals, the metatarsals, the PIP joints, and the DIP joints. And then we're going to passively do flexion extension of the ankles. Okay, and then I have you flex your feet up and extend them down. And then I have you evert to the side and then invert. Okay, same with the toes. Flex your toes up, extend them down, and then I'm gonna have you sit up and hang your legs off the side here. We did not do the flexion extension of the knees yet, for position change reasons. Okay, so passive range of motion of the knees here. Flexion, extension, flexion, extension. Okay, go ahead and flex them and then extend them back. And then you're going to abduct away from the body and adduct